Welcome to Conversations in Lung Cancer Research, a TOGA podcast where we discuss the latest breakthroughs in lung cancer research and treatment for Australia and New Zealand. My name is Surein Arulananda, and I am a medical oncologist at Monash Health. Thoracic Oncology Group of Australasia acknowledges the traditional custodians of the land on which we live and work. We pay our respect to their elders past, present, and emerging. We also extended respect to all Indigenous people. This year, I am the convener for the 2026 TOGA Annual Scientific Meeting in July. And today, I have the pleasure of previewing the ASM program with my fellow Local Organising Committee members. Today, I have Ms. Renee Grundy, a clinical nurse consultant in lung cancer from the Royal Hobart Hospital, Dr. Archit Chawla, a respiratory physician from the Nepean Hospital, and Dr. Neil Wallace, who is a radiation oncologist from the Peter MacCallum Cancer Centre. I'd like to welcome everyone to TOGA's Conversation in Lung Cancer Research podcast. So, starting off with yourself, Renee, from the sessions on our program this year, which do you think will have the biggest learning outcomes for the clinical nurse?
I'm always really impressed at the very beginning when we have the patient advocate speak, and that always sets the tone for myself for the rest of the TOGA ASM. Moving on from that, though, for nurses in particular, I think the survivorship sessions are going to be amazing. There's a lot of nurse-led clinic models of care information going on in there. Plus, the breathlessness and end-of-life care sessions also help really highlight the role that nurses help play with symptom management. So I think they're going to be some big winners for nurses.
Thanks, Renee. And in fact, during the committee meetings that we have had, survivorship was a big thing on everyone's minds in terms of something we wanted to focus on. And one of the buzz topics we have is actually on precision survivorship. Do you want to tell our viewers a little bit about this?
Precision survivorship is becoming more and more important in lung cancer as we help people live longer and longer. And part of living longer and longer is living well. So, things that we can prolong life with also causes them other problems, health-related problems as well. So it's important not to have people survive at the cost of quality of life.
Absolutely. And Renee, the program has a strong focus on long-term outcomes. How do you think the sessions are going to assist nurses who come to the conference to better support their patients?
Well, just going back to the precision survivorship, it's the whole, every discipline involved in lung cancer care is going to learn from the precision survivorship. So it's true multidisciplinary coordination there. And nurses are really central in helping the patient move through all those different disciplines and so on. So nurses leading nurse-led clinics helps patients into survivorship and beyond.
So now I'll turn to you, Archit. So Archit, if you look at the ASM program, which session would you point to as this session will make the biggest impact to my work as a respiratory physician?
Thank you, Surein and TOGA, for inviting me, first of all. It's my pleasure to represent TOGA and the Respiratory Viewpoint leading up to this very important meeting. And it's scheduled right at 12 months post-implementation of the National Lung Cancer Screening Program. But look, rather than picking one session as such, I might perhaps focus on one theme that is present through several sessions throughout the ASM, which is sustainable nurse-led models of care. I think this theme is particularly exciting to me. There'll be several talks that focus on the various aspects of thoracic oncology care, right from screening recruitment to nodule management, symptom management, and survivorship care. As we move forward into lung cancer screening era in Australia, one of the biggest challenges we'll face isn't actually technology or treatment, it'll be capacity. The success of lung cancer care in this era won't depend just on new drugs or new methods of operating. It'll be dependent on new ways of delivering care. And I think nurses are essential to the future of holistic and sustainable management in lung cancer. I think this is going to be a key enabler of the success of the screening program. And as a respiratory physician, I feel that managing patients with nodules and suspected lung cancer, we're going to be working very closely with these models and especially nursing staff in earlier aspects of lung cancer management in the coming years.
Yeah, no, thank you, Archit. And you really have alluded to the nodule talk that we are going to have. Are there any other talks you feel that will appeal to a respiratory physician? It doesn't have to be respiratory talk specifically, but from your viewpoint of our program, is there something you think that will be really intriguing for respiratory physicians?
I think there's several, Surein. It's very hard to pick my favorite, actually. Whilst we are talking on nodules, I will mention that I think if you're a respiratory physician this year, the nodule management session is probably going to be one of the more important sessions at this conference. So screening has, fundamentally changed our role in thoracic oncology. What large-scale international studies have shown is that with changes in screening implementation, there's a big change in stage of diagnosis. And instead of seeing most patients with symptomatic or advanced disease, we're now seeing large number of patients with tiny asymptomatic nodules. And so the clinical challenge isn't just detection, it's decision-making under uncertainty. Do we watch it? Do we biopsy it? Do we resect it and ignore it? And so I think this nodule management session and really the practical aspects and real-world challenges that we have been facing as respiratory physicians will be very important to discuss at the 12-month mark of the National Screening Program implementation.
Yeah.
How do we do that consistently across the screening program is going to be key to the future. And I think this is a very important conversation to have at this ASM.
Yeah, totally agree, Ashit. I think that, in fact, it will appeal to everyone in the room across all different specialties, really catch up on where the lung screening program has taken us 12 months later. So now I will turn to yourself, Neil. So, Neil, you're chairing two sessions. One, a session on treatment of oligometastases, and another, the changing role of radiotherapy in small cell lung cancer, an area that has really had a lot of advancements in recent times. What are you expecting, and do you feel your fellow radiation oncologists will expect to take away from these sessions?
Thanks very much, Surein. Thanks for inviting me to yourself and to TOGA. And yeah, I think these are two really exciting sessions, and like you say, really good for radiation oncologists to come and attend. Turning first to the oligometastatic disease setting, that's going to be from one of our overseas plenary speakers, Professor Sarah Romella from Rome, which is, I think it's going to be great to get a perspective from her in terms of what happens in Europe, what happens in Italy, because I think oligometastatic disease, it's an evolving area. It's not one that we all have a very uniform practice, I think, on. So getting different perspectives is always going to be really, really helpful. And particularly to see how she kind of approaches the topic in the context of immunotherapy and targeted therapies, because again, that's something that is ever changing and ever evolving. So getting some international expertise in that, I think, is something that I'm looking forward to hearing from her. And then in the small cell lung cancer session, we've got Jane Ludwig from New South Wales, a local expert. And as you say, lots of developments in that area. In terms of dosing, are we still using bi-daily for everybody? Is there, I know that there are some trials happening in terms of dose escalation. She may talk about once daily and higher doses being used for less fit people who are having once daily treatment in terms of how we approach that. And looking at kind of recent evidence from Adriatic, what's the role for radiotherapy in the immunotherapy era. And finally, in setting of extensive stage disease, I'm wondering, will we hear a little bit about a local study in a TROG in terms of the CHEST-RT2 using consolidation radiotherapy in the chemoimmunotherapy era in the extensive stage disease?
Yeah, there's a lot there, isn't it, Neil? Because although our systemic treatments are improving for all cancers, really, especially both non-small cell lung cancer and small cell lung cancer, the role of the radiation oncologist is actually probably more vital than ever, because it has really opened up a lot of opportunities, not just for treatment of oligometastases, but also for treatment of oligopersistent disease. In fact, speaking of which, what do you think will be your number one, don't leave the conference without seeing this session of all the sessions that we have worked through as a group?
I think that it's a really exciting program, and if someone was even able to make one or two sessions throughout, I don't think they're going to be disappointed. If there's to pick one out, I think it has to be the Thursday morning immunotherapy session, where we're going to hear from both international plenary experts, how to care for people with advanced disease when immunotherapy becomes less effective from Professor Sanjay Puppet from the Mars, and it's going to be really, really interesting. And we'll also hear about the role of radiotherapy within the immunotherapy landscape from Sarah from Rome. And I think we'll have some further talks on kind of practical aspects of dealing with people with lung cancer who've got advanced disease. So I think it's going to be a really practical session. And we're going to get some really, really interesting perspectives from our international experts in it. So Thursday morning, I would be making sure to be at that one if I could.
Yeah, thank you, Neil. And if I can add to what my colleagues have talked about in terms of what I feel may be a hidden gem for a medical oncologist, Neil has very nicely alluded to the Thursday morning plenary session, which has a focus on immunotherapy. One of the sessions there will be on the discussion about the use of immunotherapy in non-small cell lung cancer. We know that this year we have broad access to immunotherapy. And although we've been using immunotherapy for close to a decade in lung cancer, I feel that there is still a lot to learn and a lot to learn from each other about how best we can use these drugs. For instance, how do we manage beyond the 2 years? Do we continue? Do we not? Are there sort of clues that we may be able to gather from how we make these decisions? How do we manage PD-L1 or anti-PD-1 failure? Importantly, how do we manage patients who have had severe toxicities and develop disease relapse later? So this session will be presented by my colleague, Associate Professor Melinda Itchens from the Royal North Shore, and it'll be a really nice session to back what I think will be a fantastic opening and futuristic session about immunotherapy and different types of immunotherapy by Professor Sanjay Puppet. And then I suppose the session that I personally am most looking forward to as the convener of the conference is a session on Friday morning, which has a focus around small cell lung cancer. I alluded to earlier that there have been huge advances in small cell lung cancer in a short space of time. And one of our international speakers has been leading small cell lung cancer trials for quite a few years now and has ample experience, not just in T-cell engagers and antibody drug conjugates, but also in cell therapies. And hopefully we'll be able to learn about all the newer treatments that we are about to see in small cell lung cancer. And that will be followed up by a nice discussion around a radiotherapy, as Neil mentioned as well. So I think that will be a session that all of us can certainly gain something from. So now I guess if I can go back to you, Renee, if you could pick one session from the ASM that every member of the multidisciplinary team should attend, regardless of their specialty, which one do you think it should be and why?
I'm going to stick with my precision survivorship theme for this one and say everyone should go to that one because we all need to work together for this. So that would be my pick.
Yeah, good call. Archit, what about yourself?
I hate to jump on what Renee said, but look, my session would be exactly the same, survivorship and supportive care session. I think as with screening comes about and as our oncology treatments improve, as our surgical techniques improve, we're diagnosing people at much earlier stages, and people are living much, much longer. And so I think survivorship becomes more and more important looking into the future. This is my session to go to, and I think this is a conversation that all specialties need to be involved in.
Yeah, thank you, Archit. And Neil?
I hate to make it 3 out of 3, but I'd also earmark this one. I think it is fantastic. I think it has something for everybody. You know, I think the concept of precision survivorship is really important, and that'll be Mary Duffy, who's a fantastic speaker. Really looking forward to hearing her perspectives on that. And managing breathlessness is something that everyone working with people with lung cancer, you know, will benefit from learning more about. So I really do think this is going to be a fantastic session that I think we can all look forward to.
And I'm going to make it 4 out of 4 because I totally agree. I think the idea of precision survivorship, managing breathlessness, and utilizing our nursing colleagues in everything that they do to keep everything running for patients is so absolutely crucial. So this is the session that I think everyone needs to go to. It is on Friday in the later morning of the morning session, if you like. And I hope to see all of you there. Now, the debate is always an entertaining session to witness. Certainly from previous years, I've had some of my best laughter watching the debate. Archit, maybe you can take us through the rough theme of the debate and tell our viewers about what they are potentially going to witness.
Thank you, Surein. I might actually change my answer to the debates because that's going to be so much fun for everybody to witness. So, look, I'm going to say something lighthearted, and I hope there are DC fans out there. But I remember a quote from Batman that some men just want to watch the world burn. And I think this is when I thought of when I suggested that one of our debate sessions should be on the management of the malignant nodule. Who's in charge, surgery or radiation? Because I think this is an incredible topic, and I think there's incredible advancement in both fields. And as we talk more and more about nodules into the future, this is a conversation that we will keep on needing to have. And I think from my viewpoint, surgeons and radiation oncologists both have something great to offer. Both actually believe their therapies are excellent, and they are. And what we want to do is actually bring them out there in a lighthearted way and actually discuss amongst all of us on how we should go about the future. I think this is going to be a really fun and exciting debate. The second debate, there is also going to be a second debate on technology and AI. And of course, I think that's going to be part and parcel of our future. So I would love to see who is going to argue against technology and AI and how they go about it. But I know it's going to be an exciting one.
So Neil, if we could sort of go back to the nodule debate, do you have any predictions about who do you think is going to win that tussle, radiation oncology or the surgeons?
I think it'll be hard fought, and I think the moderator is going to have a tough job keeping our speakers on track. I'm hoping that as many of my radiation oncology colleagues as possible will come out to support our speaker in that one to help us get over the line. But always tough to overcome the surgeons in these things, but we'll do our best.
Yeah, and Renee, with the technology discussion, I mean, everything seems to be about technology advancements, AI, etc., etc.
Maybe we should get like Heidi or ChatGPT to defend their own corner. Maybe that's something we could do.
That is a great call. It might be a bit too technologically savvy for this year's ASM, but I'm sure one day we can incorporate that. Do you think you'd be betting against the dark horse of the person betting against or fighting against?
I think AI is going to win that one. It makes life a lot easier.
That brings us to the end of this episode. Thank you, Renee, Neil, and Archit for joining us during the discussion. And as always, thanks to our viewers for listening to TOGA's Conversations in Lung Cancer Research. If you enjoy our show, please rate and review us on Apple Podcasts or Spotify.